Morning. We want to welcome Chris Abbott, who is a health plan chief executive officer at United Healthcare, Medicare and Retirement with over 20 years of experience. Good morning, Chris. Thank you for joining us this morning.
Good morning, and thanks for having me on.
Yeah, so we mentioned that it opened yesterday, enrollment opened yesterday. How long does this continue, and how important is it for people to get signed up if they need it?
Well, you're right, Lou and Jackie. It's incredibly important that everyone who's on Medicare pays attention right now because the open enrollment period has started. It started yesterday, October 15th, runs through until December 7th. So you've got to take action by December 7th. 58 million Americans across the country are on Medicare, so this is one of the key activities that's going to happen over the next couple of months. It's important because if you're on Medicare, this is typically the only time you'll have to make a change, to pick a plan, to, again, make adjustments with your coverage for 2018. Whatever it is you wake up with on December 8th, is therefore going to be what you're going to live with next year. That's why taking action by December 7th is so important.
Now, what are some of the things you should consider when enrolling for your Medicare plan?
Well, there are a couple of things. When I look at this, I think people should start by first checking the coverage that they have today. So if you have a plan, you would have gotten a packet of information over the last couple of weeks called your annual notice of change. And then take a look at what changes have been going on in your life. Perhaps you've been newly diagnosed with a chronic disease, unfortunately. Perhaps you've moved, so other things may have changed in your life. So it's important to kind of start with where you're at today. Next, be honest with yourself. Take a look at the impact on your wallet. Lots of times people are focusing first around the premium they're paying for their plan, but it's important that you also look at the cost sharing when you go into the doctor's office or you go in the hospital. So you're balancing all of the financial parts of the equation. Next, check to make sure your medications are part of the plan. So whether you have a Medicare Advantage plan or you have a standalone Part D plan, the medications you're taking are on the plan and they're continue to be affordable. Next, I would double check that the hospitals and doctors you prefer to access, you're going to be able to continue to do that, independent kind of which particular way you get your Medicare, that your doctors and hospitals are, again, part of the program. And then finally it's important that you take a look at some of those extra benefits that are available on Medicare plans. If you're in need of a hearing aid, as an example, you want to select a plan that offers coverage for a hearing aid. Glasses might be another one. Certainly an area at United Healthcare we focus on is those wellness programs such as a gym membership that can help you feel better, live better, get more out of your healthcare experience.
Now, the gym membership is the one that just jumped out here. No, that's really important. Not all the plans have that, do they?
It's true, and this is, again, one of the reasons why it's important to shop each year during the open enrollment period. That gym membership is a particularly popular benefit. But I would also say, again, glasses, hearing aids are some of the things that people are looking for. And one of the things I'm always surprised to hear is as people come into Medicare, one of their first reaction is, wow, I've been waiting to get on Medicare, it covers everything. And the answer is, no, it doesn't, which is one of the reasons why looking at some of these additional benefits is important. Traditional Medicare does not cover hearing aids. It doesn't cover glasses except in very limited situations. And then finally, guess what? Traditional Medicare doesn't cover routine dental care. So these are the kind of benefits that you can get through a Medicare Advantage plan, but you need to shop and get the ones that matter to you.
Is that going to be the biggest difference between like original Medicare and Medicare Advantage? Are those little perks that we're talking about right now?
Well, they are one of the areas that differentiates traditional Medicare from Medicare Advantage. I would say two other ones are really important. The first off is Medicare Advantage typically has the prescription drug benefit built into the program, so you don't have to buy a separate one. That makes the approach much more convenient. It's simpler, really kind of one card brings together all of these benefits into a single package. But the other essential item that Medicare Advantage brings is financial protection. Traditional Medicare, as good as that coverage is, has no limit on what you might pay out of your pocket in a year. With a Medicare Advantage plan, not only does it provide financial protection, it's typically making your cost sharing more predictable. This is one of the reasons why over the last 5 years we've had nearly 50% growth in Medicare Advantage enrollment. Nearly 1 out of every 3 Americans who are on Medicare have signed up via Medicare Advantage.
And how much more of a cost is Medicare Advantage to straight Medicare?
Well, that's a great question because frequently there's no additional cost. So in order to be eligible for a Medicare Advantage plan, you do have to have Medicare Part A, Medicare Part B going. Most people do not pay a premium for Medicare Part A. They earned it through their working life. But Medicare Part B does have a premium. It's based on your income. So again, whether you're on Medicare Advantage or not, you do have to pay your Part B premium. So in the case of Medicare Advantage, there are frequently plan choices that have no additional plan premium. United Healthcare actually has some of those programs in Des Moines. 0 additional monthly plan premium. They get all the benefits we've been talking about without having to pay an additional premium on top of their Medicare Part B.
Well, Chris, we only have a few more moments with you. If there was one point you wanted to get across here as we end our interview, what would that be for those individuals this morning wanting to learn more?
Don't put off taking a look at what makes best sense for you. If you're looking for more information, you can go online, uhcmedicareplans.com. You can check out all the choices we provide at United Healthcare. If you're looking for a little more broader selection, you can go to the government's website, medicare.gov, compare plans at the zip code level, or you can give us a call today at 1-800-UHC-6509.
Wonderful. Well, thank you so much for your time. I know you've answered a ton of questions here. We really appreciate it. And again, if people have more questions for you, they can just go to the website and get those questions answered. Thank you so much.
My pleasure. Thanks for having me on today.
Wow.